well, we'll get started. Thanks for joining us if you're watching this online afterwards or in person today. What we're going to talk about today is how we can help get you out of pain in 2021. So we're going to go over a little bit of dry needling. I'll speak about that for a few minutes, and then Angie McCormick is going to go over how you can use proper nutrition to help get you out of pain as well. So we have some presentations here. We'll share our screen. All right. So first, we're going to talk about dry needling, which has been a pretty hot topic. Some people have heard of it, some people have not. But what it is an acupuncture needle that we use to penetrate deep into the tissues. And what that does is create a little lesion to start the healing process. We call it dry because we're not doing any injecting of medication. So if you go to your doctor and get a cortisone injection, that would technically be considered a wet needling action because they are putting a medication inside of your body, which here we're just using a monofilament needle. We're not injecting anything. We're just using that to actually go in and disrupt some of that tissue. The biggest question I get every single time is, how is it different than acupuncture? So acupuncture originated in China over 2,000 years ago. So it's based upon very Eastern medicine. They have mapped out different meridians throughout the body. And what acupuncture does is goes along those meridians, and they place needles more superficially from head to toe. And that is to help clear those meridians, bring balance, restore your chi and the flow of everything through your body. So they'll be using a lot more needles placed, like I said, from your head to your toe and very superficially. Whereas in dry needling, we're going to go deep into those muscles, pretty locally as well. We're going to stay and find those spots that hurt and stick those needles in to kind of help break up that tissue. So how does dry needling work? Like I said, we stick those needles in to help break up a trigger point, which a trigger point is a hyper-irritable spot. You might find when you talk about those knots that you feel in your neck or you feel in your back, your leg, and if you push on it and it kind of sends pain, or maybe it sends pain down your arm or shooting up your back, that's what we refer to as a trigger point. And so dry needling works by going right into that knot, and we're going to move that needle around to try to break up the muscle tissue and the fascia that have those trigger points in them. And essentially what we're doing is creating different lesions and starting an inflammation process. So it's kind of like we're hoping that area will start to reheal itself after we stick a needle in there and create lesions, break up tissue. We're going to restart the healing process. And when we do that locally, you have an immediate effect. So you start to feel the immediate reaction. So you might start to get a muscle twitch, you might get some jumping of that muscle, you might feel some pain, some tenderness, but once we take that needle out, that pain goes away. We can piston, wind, or add some stimulation as well to those needles. So when I talk about pistoning, that's me moving the needle up and down. And then if we're winding it, I can kind of twist that needle around, which is going to grab onto some of that muscle tissue and twist it, helping to loosen it up and create a little bit bigger of a lesion. So not only does it work just locally at that muscle, but it's going to work total body or systemically. So when we stick needles in, if we leave them in for 20 to 30 minutes in an area, your body is going to start a cascade of releasing natural pain relievers. So from your brain, it's going to send signals down, and you're going to get a rush of those pain relieving chemicals going through your body. Now, if we add stimulation, such as in this picture, we can hook up a TENS unit to those needles, and it will get deep stimulation into the muscles. That is going to have an even increased effect. So you're going to get more of those systemic opioids, natural pain relievers to flood your body when we add those. So what does it work great for? So we can stick needles in a lot of different places. Like I said, wherever you find that you have those tight muscles, those tight muscle knots, but we use it here specifically for shoulder pain. So we can go all throughout the shoulder, into the elbow and wrist. We're going to go into those muscles, into the joints there. Low back pain, especially hip pain and sciatica. Knee pain, as you saw in the last picture. And then headaches and migraines is a big one. You can see in this picture, kind of looks crazy with the needle sticking out of their head there. But once again, we're going for some of those tight muscle and fascia points, and it can kind of help relieve those headaches, especially if they're coming from tight muscles throughout your neck and throughout your head. And then it works all the way down to foot pain and plantar fasciitis. So a few things, if you are thinking about doing dry needling, things that we do not want to stick a needle in you are if you have any metal allergy. We want to make sure that we're not going to stick something that you're going to have an allergic reaction to in there. Any systemic blood disease. A big one is needle phobia. So if you hate needles, dry needling might not be for you, because you do have to sit there and be pretty calm. We don't want people passing out. We don't want to stick it into any active cancer. And then there's a few other things. If you have had a back surgery, and they have taken out some bone, or your anatomy is just a little bit different, we don't want to stick a needle in there, just because we want to make sure that we are not going to go too far towards your spine. We want to stay out of that spinal canal. We want to have a nice bony backdrop. So if you've had a spine surgery where they've removed some bone, we won't stick any needles in there. Immunocompromised patients, infection rates are pretty low, but they still don't want to take any chances of doing any dry needling. And then we don't want to do around any implants or during pregnancy. So a few precautions of dry needling is if you're on blood thinners. The needles are so thin that they typically do not puncture any sort of artery or vein, so you don't get bleeding very often, but occasionally, especially if you're on blood thinners, you might get a little bit of a bruise from dry needling. There has been studies that showed if you are diabetic, your glucose levels may be affected. So it's just something that you want to watch out for afterwards and make sure you're monitoring yourself appropriately. And then after any joint replacement or surgery, once again, they want to keep that risk for infection pretty low. Adverse reactions could be fainting. So if you don't enjoy needles and are sticking them in you, we make sure that we get you laid down, so that way you don't know what your body's going to do. We want to make sure you're safe, and that if you would have a reaction like that, we can keep you pretty safe and not falling out of a chair or anything. A pneumothorax is the other very big reaction, and that is if we would puncture a lung. So with dry needling, because we don't have any sort of imaging to help us guide those needles, we're going to steer clear of anywhere around those lungs. So that meaning we're not going to stick them kind of into your ribs or anywhere through there, just to be clear that we're not getting any lung tissue. Infection, very rare, but we are entering the body with a needle, so that could happen. And then, as I mentioned, bruising or bleeding is rare, but it can happen if we do disrupt some of those blood vessels. And then pain following. As with anything, we can have some pain that enters. All right, so that's all I have for dry needling. Now Angie is going to start to talk about nutrition and how that can help. And if you have any questions, do feel free to shout it out, or you can type it into the chat as well. So, all right, I'll get her all set up here.
All right, well, hello. My name is Angie McCormick, and I am a physical therapist at Balance Fitness and Health, and I just wanted to share with you how you can use food and nutrition to decrease your pain as well as increase your energy. So a lot of the people we see in physical therapy obviously have some sort of underlying inflammation going on, whether it's causing an arthritis type pain or back pain, autoimmune disease. We can use, as Kaylee was talking about, dry needling in conjunction with regular physical therapy, but also we like to educate people on nutrition and how that can help. So first and foremost, this information is not intended to be any substitute for professional medical advice. So you always want to talk to your doctor before beginning a new diet or exercise program. So the goals for today is that you'll understand the power that food and lifestyle can have on your health, that you'll learn which foods nourish your body and which foods deplete your body. And then you'll understand that through nutrition and lifestyle choices, you can increase your energy and decrease pain, improving your overall well-being. So ultimately, when you eat food, you have a choice. You can either nourish your body or you can deplete your body. Obviously, when you think about how to take care of your car, you would never put gas in a diesel engine or diesel in a gas engine because it wouldn't run smoothly or efficiently. So it's the same thing with your body. You want to take care of your body, obviously better than you probably want to take care of your car. So you've got to put food in it that's going to help it to run efficiently. So how does this work? Ultimately, your body is made up of millions of cells. Every cell, tissue, organ, and every system in the body needs specific nutrients in specific amounts to function efficiently and effectively. These nutrients are all used for millions of chemical reactions that go on in your body throughout the day. Every tiny detail, from you breathing to wiggling your pinky toe, all requires specific nutrients. Those nutrients are kind of grouped into two different groups. One is macronutrients and the other is micronutrients. And I'll break those down here in a little bit. But just know that being slightly deficient in either one of those can cause negative health consequences. So your macronutrients are your carbohydrates, fats, and proteins. Those are the ones you probably heard the most about. Carbohydrates are your easiest source of energy. They're your fruits, your vegetables, sugars, things like that. Fats are also a source of energy, but they're also energy used for energy storage. Those are your oils, your butter, your nuts, your avocados. And then proteins are the building blocks of your cells. So things like meat, eggs, some dairy products, legumes, and nuts can also be protein. More importantly, the micronutrients, they're small but mighty. Those are where you're going to get the biggest bang for your buck. So just these are four that I just listed here that you've probably heard of, but they're pretty powerful. Vitamin B12, which is a huge source for energy metabolism. It's also important in cardiovascular and brain and nervous system health. Vitamin C, we all know that's important for immune system function, but it's also a potent antioxidant, and I'll talk more about antioxidants later. Magnesium is one that the majority of people are deficient in without knowing it, kind of flies under the radar, but it is involved in 300 chemical reactions in your body. So if you're deficient in magnesium, which again, a lot of people are, it affects you in multiple different ways. But a big one when it comes to physical therapy is magnesium helps control inflammation. So that's a quick hitter when we want to decrease inflammation. Vitamin D there's a lot of talk about vitamin D right now because it's big with COVID-19. There's a lot of research being done about the severity of your COVID-19 symptoms and your vitamin D levels, with lower levels of vitamin D being associated with more severe risks or severe symptoms of COVID-19. So it is also important in immune system function, but it can be a potent anti-inflammatory agent too. So when you want to know which foods to eat, you want to think about nutrient density. Ultimately, you're getting the most bang for your buck when you get foods that are high in micronutrients, but pretty low in calories. Low nutrient dense foods are going to be just the opposite. So they're going to be low in nutrients, but super high in calories. And I know you're probably thinking if they're nutrient dense foods, then they probably don't taste good, which depending on what you're used to and how you cook, that might be the case. But just know that it's important to get those nutrient dense foods in. And then as your body gets those nutrients, it starts to crave them more and more, and you want the low nutrient dense foods less and less. So what do the depleting foods actually do for us? besides creating inflammation. They cause a blood sugar spike and crash. That's what results in your decrease in energy. They also cause an imbalance of good and bad gut bacteria. You've probably heard a lot about probiotics and how beneficial those are. I could do a whole presentation on that, but that also, if you have a lot of bad gut bacteria, that can create inflammation. They also cause weight gain. And when you have weight gain, it promotes obesity, and obesity is associated with inflammation. And then all of those things in general increase inflammation. And it has been shown that these diseases that I have listed here, cancer, arthritis, diabetes, autoimmune disorders, all of those we're starting to learn that are related to an underlying chronic inflammation. So that's where I'm going to sit here for a little bit and address and just talk about what inflammation is and how that creates those diseases. Oh, let me get rid of that. Okay. Not sure. Oh, yeah. Okay, sorry about that. Hit the wrong button. All right, so the inflammatory process, what happens is you have some damaged tissue or a presence of an antigen. So you could have like a splinter that's going to create damaged tissue. Toxins, bacteria, viruses, those are all things that will begin the inflammatory process. So once you have that, the cells around that damaged tissue start to release chemical mediators. These are things like histamine, bradykinins, and prostaglandins. Those words probably don't mean a whole lot to you, but just know that those chemical mediators are what starts that whole inflammatory process. So in like an acute injury, when those things are released, you'd see that traditional swelling, heat, redness, and pain, like if you sprain your ankle. But once those injuries are resolved or that the antigen is removed, in a healthy immune system, your body stops and the inflammation subsides and it moves on. Unless for some reason, your body continues releasing those low levels of those chemical mediators. Then you get what's called chronic inflammation. So chronic inflammation is a slow, long-term inflammation that lasts several months to years. So in 2014, 60% of Americans had one chronic condition. I imagine that number has been updated more recently and is probably much higher, especially given the pandemic over the last year and a half here. So that exposure to a low-level irritant or foreign material is what causes that chronic inflammation. So essentially what happens is you get this slow, low release of inflammatory mediators, those chemicals I talked about before. So it's slow and low enough that they kind of fly under the radar. So you're not going to see the big blow up in redness, swelling, and heat necessarily, but you're going to gradually see more soreness, more general inflammation, more fatigue, things like that, that once you top out your bucket, eventually something's going to cause it to overflow, and then you're going to have a massive injury, be diagnosed with a disease, chronic disease, something like that. So chronic inflammation also causes oxidative stress and mitochondrial dysfunction. So this results in increased free radical formation. And I'll talk a little bit more about free radicals in a minute. But ultimately, this chronic inflammation, as I said, is associated with all these chronic diseases, such as diabetes, cardiovascular disease, arthritis, even allergies, COPD, and obesity. So how does food cause this inflammation? Well, diets rich in trans fats and refined sugar are associated with higher production of those chemicals that I talked about. So essentially, when you ingest trans fats or those refined sugars, your body starts to release those chemical mediators, and then you get that slow, low level of inflammation. So what are trans fats? They're hydrogenated oils. So they're found in margarine, processed snack foods, commercial baked goods. Essentially, the purpose of trans fats is to prolong shelf life. So anything that can sit on a shelf or in a box and not rot tends to have trans fats in it. Trans fats have also been linked to higher LDL, the bad cholesterol, and lower HDL, which is your good cholesterol. Omega-6, 6s are also inflammatory. So omega-6s are found in processed foods that are made with vegetable oils. So when you read labels and you see soybean, corn, canola, sunflower oils, those are your vegetable oils. So those are higher in omega-6s, and omega-6s increase inflammation. Omega-6s are also found in grains and grain-fed animal products. So there's kind of a big push right now for grass-fed beef or pasture-raised pork, pasture-raised chicken, that kind of stuff. And this is why, because they tend to have a lower amount of omega-6s, therefore a lower level of inflammation. And the important thing to remember about omega-6s is that they are necessary for proper immune function. So the key is to find a balance. So we've probably heard about omega-3s, and those are super anti-inflammatory. That's like your fish oil. So a lot of people take fish oil for cardiovascular health, or you're told to eat a lot of fish once or twice a week. So the key is to keep that balance between your omega-3 and your omega-6. That balance should be a 1-to-1 ratio, at the maximum a 1-to-4 ratio. Typically in today's standard American diet, that ratio looks like more 1-to-16. So we're just super inflamed because we take in so many omega-6s. That again, an excess of omega-6s has been linked to the chronic diseases like cancer, cardiovascular disease, and such. So ultimately you want to read the labels. If you see the words hydrogenated or partially hydrogenated oils, those are omega-6 fats. The other way food can cause inflammation is that foods that really spike your blood sugar also cause a spike in insulin, and that spike in insulin propels inflammation. So it's been shown that refined sugar elevates those inflammatory mediators that we talked about before, just 30 minutes after ingestion. So again, they start that cascade of a low level inflammation. Excess intake of sugar and refined carbohydrates also causes more oxidation and free radical production. And free radicals then signal the inflammation to start. Chronically elevated blood sugar is also linked to obesity, and obesity is associated with chronic low-level inflammation. And the reason is because we tend to store toxins and waste materials in fat tissue. So if you have excess fat tissue, you're going to have more of that low-level inflammation going on. Last but not least, these foods cause inflammation because they simply just replace higher nutrient dense foods. It's the reason we're always told not to eat dessert before a meal, is because then you don't have room for the good, healthy stuff. That's the main point behind not eating those kind of foods as often, is because you just take the place of the nutrient dense foods. So I talked a little bit about free radicals and antioxidants. I just want to touch on what those are, as some people may not be aware. Free radicals are formed during energy production of all the cells. So if you're just sitting there doing nothing but breathing, you're going to produce free radicals. So we want to take in antioxidants to combat that, even if we're doing nothing else to promote free radical formation. You can eat the healthiest diet, you'll still produce free radicals. The key is to balance it out. So free radicals signal inflammation, and then they create the damaged tissues, damaged cells, that then leads to the chronic diseases. So antioxidants stabilize those free radicals. So they're going to prevent the damage to the cell tissues. They're going to delay the aging process, and they can even repair some of the damaged tissues. Thus, they reduce your risk for cancer and any other chronic disease. So in summary, nutrient-dense foods are going to fuel our cells, increase our energy, stabilize your blood sugar, and decrease inflammation and pain. And depleting foods are going to damage our cells, decrease our energy, elevate our blood sugar, and promote inflammation. So what do we do about it? Foods to include. So when I talk to somebody about things that they can do to speed their healing or decrease their inflammation in general, these are the things that I recommend. So ideally you eat a lot of whole foods. That's a food that has not been changed since it's been harvested. It's as close to its natural source as possible. So it's your fruits, your vegetables, your meats, nuts and seeds. It's a lot of the foods that our grandparents probably ate when there wasn't a store on every corner and you actually had to eat from the land. Eating organic when possible. The Environmental Working Group puts out this Dirty Dozen Clean 15 list every year. This is their most recent list. So essentially the Dirty Dozen are the 12 fruits and vegetables that typically have the most toxins or chemicals associated with them. So those are the ones you do want to buy organic as much as possible. Versus the Clean 15 are the fruits and vegetables that are going to have the least amount of chemicals used. Those are the ones you can buy conventionally grown more often. Again, organic I know is more expensive, but you can do things like buying frozen over fresh, or getting the fresh when they're in season and freezing them and using those things to help outweigh the cost. Other foods to include are those that are high in anti-inflammatory things such as the omega-3s, the bromelain and curcumin. Things that are high in those are going to promote anti-inflammatory foods. So things like green leafy vegetables, salmon, celery, beets, broccoli, berries, pineapple, walnuts, chia and flax seeds, ginger and turmeric have that curcumin in them. So those are two spices that you can use to help with that. This is not an exhaustive list by any means. Pretty much any whole food is going to have some sort of anti-inflammatory component to it. But these are the big hitters. If you're really, people that are post-surgical and really looking to decrease inflammation fast, these are some big hitters for them. We talked about getting antioxidants in. So this is a list of foods that are high in antioxidants. Taking vitamins such as vitamin C, E, and CoQ10, those are big antioxidants. But getting your berries in, cherries, dark leafy greens, green teas, some of those herbs there that I've listed, as well as dark chocolate and coffee, are all high in antioxidants. Those will help combat those free radicals, so you produce less free radicals. The other thing to include are healthy fats. So we talked a lot about trans fats and the omega-6 fats. So these healthy fats are higher in the omega-3s and not as high in the omega-6s. So olives and olive oils, avocado, coconut, pasture-raised meat and eggs, nuts and seeds, and then wild-caught seafood, as well as just fish oil, taking a fish oil supplement too, instead of the wild-caught seafood if you don't have access to that. It's also important to drink a lot of water. As a physical therapist, we do a lot of manual therapy here, so I can often tell if somebody's tissues are really dry, and just recommending them getting in more water can make a huge difference. Ideally, you're doing filtered or spring water. Mineral water is also good. You want to drink half your body weight in ounces is a place to start. A lot of times people tell me that when they try to do that, they end up going to the bathroom more times than not throughout the day. So if you actually add some electrolytes, even a little pinch of sea salt, lemon, cucumber, things like that to the water, your body will absorb it better, and then you'll spend less time going to the bathroom, and your body will benefit from that water greater. So foods to exclude, probably all the ones that you know you shouldn't eat, but it's good to see the list. Sugar, again, we talked about how that's super inflammatory, and then the saturated fats and trans fats. The omega-6s, we talked about those being in grain-fed animal products and the vegetable oils. And then as you go down the list there, gluten is a big hot topic, always is. It can just be really hard for some people to digest, so it can create some inflammation in the body. And then casein is actually a protein found in dairy. The same thing, a lot of people have a hard time digesting it. So when you don't digest it completely, your body starts to attack that, and then it creates that low level of inflammation. Other inflammatory foods, chemicals, and then genetically modified organisms. The jury's still out on those. We just don't know the long-term effects of that. And again, because it's been modified from its original source, it's not necessarily a good thing or something that your body can recognize and know what to do with when it's ingested. Other foods that you want to avoid is anything that you may be sensitive to. So one man's pleasure may be another man's poison. Just because a food is healthy doesn't mean that your body may tolerate it well. For example, in the past, I did not tolerate coconut well. Coconut is supposed to be super healthy for you, but every time I ate it, I had some issues with it. So even though it's healthy, it may not be healthy for you. And it can also present itself as more than just a stomach ache. It can present itself as nausea or headaches. For me, it's like running nose, congestion type symptoms. And then also for me, I can get some joint pain with certain foods. So you just have to be careful to watch and kind of pay attention when you eat something. If you don't feel good afterwards, you have to start to narrow that down. Other ways you can determine what foods you're sensitive to are by a blood test or an elimination diet. An elimination diet typically is more accurate, but it is 30 to 90 days, and you have to stay pretty strict on that. Last but not least, it's not all about the food. So just remember that lifestyle does matter in decreasing inflammation. These are just a few of the things that you also need to focus on, and I could do a whole presentation on each one, but I just wanted to touch base on a few of them. Sleeping, getting that sleep in each night, being deprived of sleep is going to create low-level inflammation as well as stress and anxiety on the body. Stress management, moving more, getting that exercise in, building relationships and getting outside are all important aspects of lowering your inflammation on top of just the food. So in conclusion, by increasing nutrients and eliminating depleting foods, you will increase your energy, decrease your inflammation, and improve your sleep. You wouldn't put diesel in a gas engine, so make sure you don't put depleting foods into your body. With that, does anybody have any questions? All right. Feel free to give us a call if you have any questions or something more comes up. Kaylee can be reached at the same email, just using Kaylee instead of Angie there. Or you can just call the clinic.
Awesome. We will also post these videos online, so that way you can share them with anyone that you want. They'll be available anytime that you need it then to kind of review or go over if you have questions. So, all right. Thanks for joining us.